Good day, everyone. Welcome to another YMCA Education Series talk. Today we have Denise Schwartz here talking to us about heal hip pain naturally. All right, let's see. So today's recording, we will make it available on podcast so you can review it later if you're just watching it live now. Typically, these programs last about an hour. Denise Schwartz will do questions towards the end of their presentation. All right, okay. With that, I would like to welcome Denise Schwartz. She will be talking about heel pain naturally. Are you unable to walk or exercise like you used to because of hip pain? Is lying on your side causing you pain? Do you sit a lot and then hip pain when you stand and begin walking? I do. Are you wondering if the pain is from your hip joint, hip muscles, or back? Well, then today's talk is for you. With that, we'd like to welcome Denise. Denise is a licensed physical therapist specializing in treating pain using a holistic approach to discover the root cause of pain and provide natural healing options. So with that, we'd like to welcome Denise to talk about hip pain. Thank you, Denise.
Thank you, Pam. I appreciate it. Okay, I'm going to share my screen. Okay, hold on. Oh, there it is. Okay. And one last thing. Where is it? Let's see here. Okay, you can see my mouse moving around here?
Yep.
Good. There we go. Okay. I think now I'm set up logistically here. And I can't see any of you. So as Pam said, I'll save questions for at the end. You can write them in the chat box or make a notation to yourself to remember to ask at the end. I was just saying with one of the participants, it's nice to do it in person because then I feel like there's more interaction and communication. However, this has worked out very nicely for everybody. More people can attend, I think, and we get more accomplished. So as Pam said, my name is Denise Schwartz. I am a physical therapist, and I am owner of the Manual Touch Physical Therapy in Wheeling. I am at Milwaukee and Dundee Road. So those of you who live in Northbrook, because that's where you are at the Y, I'm just outside of the border, so very close. Today, we're going to talk about healing hip pain naturally. So when I got out of school many, many years ago, I'm now a PT, I think 35 years. I knew that back pain was the #1 reason people went to see their doctor. So, once you leave school, we take lots of continuing education classes. And I primarily did a lot on treating back pain and became an expert in that. And then, of course, along the way, I took classes in all sorts of other types of issues. Along the way, I had, let's see. Oh, so in the beginning, I used to work at Lutheran General Hospital. I saw people in the hospital for a couple of years and then concentrated into what we call outpatient, which is what it is now, where people come to see me in the clinic, mostly for orthopedic issues. I don't work with neurological, such as stroke or head injury. Along the way, all the classes that I initially took were more what I would call traditional physical therapy. Find the problem, try to fix it. It's a very direct approach. And I found that everybody could respond to that, particularly, anything that's a little aggressive or hands-on. So I started studying a non-traditional therapy called integrative manual therapy. And this is a very holistic, hands-on approach to healing the body as a whole. Where in your body is preventing you from healing? After a couple of years of studying this work, I found I really had a knack for it. And I found those people who didn't respond to traditional therapy could respond to the non-traditional therapy. I left the hospital to work for the company called Center IMT, and we had a clinic here in Wheeling and one in Elmhurst. And then, oh gosh, it's 13 years ago now, we parted ways, and I just took over the practice and became the Manual Touch Physical Therapy. What I realized is once I shifted to work for Center IMT, I kind of tossed out a lot of those traditional techniques. And now I started my practice, I realized there were a lot of good stuff there. So now I use what I call a whole body approach of traditional and non-traditional therapy to get people back doing the things they love to do. It's kind of like putting the pieces of a puzzle together. When you come in and you tell me your story, and then we look at you, the whole body and the whole picture, putting the pieces of the puzzle together to find the best approach for you to heal. Along the way, I had developed a passion for running, and I did many half marathons and a marathon, and I took a lot of classes in treating runners. So I'm an expert in working with runners and triathletes. My son's a triathlete. I am no longer running because I just had my 60th birthday. I had some big toe arthritis, needed surgery, and so running is not the best thing for me. But I still enjoy treating them. I've added a new tool to my toolbox that I love to tell people about because I felt like this was the missing link when I learned about it. It's called an OOV. Here you can see it on the device, OOV. We don't know why it's called that. It was created by an Australian osteopath. And what it does, you can lay on this, you can stand on it. There's laying on it. You can be on your stomach, your side, standing. And it works your body three-dimensionally, so you cannot compensate. So when people come in to see me, a lot of times a vast majority of the time, I'm helping them re-educate their bodies to work as optimally as possible. And sometimes it's very hard to feel what we need you to feel. This takes the mind out of there and you work your body subconsciously. And you can see this is an older gentleman, and I have it behind his back. This was somebody a little younger. Here, this is my son doing a very advanced technique. He's on one leg doing an exercise with the band. And here's an older gentleman where we're working on some balance. And this stepping over it and standing on it really helps, particularly for those people with hip issues, learn how to use those hip muscles that have kind of turned off. So I love this device, and it doesn't matter how old you are or what status you are, or how active you are, et cetera. I find it, we can find a position to get you in and make you feel better. So today's topic is hip pain. And we're going to discuss the three main causes. We're going to go over the anatomy of hip and what do we do about them and how do we figure out what's really the problem and how to effectively treat it without hopefully needing surgery. There are cases where that is appropriate. So the most common causes of hip pain that I see in my clinic are arthritis or degenerative joint disease, weakness, and the tendonitis or a bursitis. So the first thing I want to know when someone comes in and says my hip hurts, I want to know where does that hip hurt? Because everybody defines their hip differently and it means different things. So if someone says it hurts in their butt, it may actually not be their hip. It could be our hip muscle. It could be coming from your SI joint, sacroiliac joint, and we'll go over what that is. It could be coming from your back. At the front of the hip could be a number of things. It could be muscle tissue that's going in the front of the hip. Some people will tell me it hurts in their groin. And this is where, you know, the first piece of the puzzle, this could mean it's your hip has degenerated. It could be, so it could be an arthritic condition where you actually probably do need a total hip. It could mean it's a labral tear, which is a tissue inside the hip joint, or it could be a muscle. And then probably the most common is people, it hurts on the side of their hip. And this is more commonly, typically a bursitis or a tendonitis, but it could be coming from your back as well. What are the common complaints people have? This is where I love to be in person because I go around the room and ask you when does it hurt you? And we come up with all sorts of stuff. Sitting is very common, particularly if it's the front of the hip, because that's usually a hip flexor tendonitis of some kind, because we're all sitting. So many people sit so much, those muscles shorten up. You go to stand up and it goes, I don't want to stand up and lengthen. And so it spasms on you. People might hurt when they're standing or walking. And that could mean something from the hip joint. It could be a muscular thing in the hip. It could be coming from your back. It hurts when I lay on that side. That usually clues in it's probably a bursitis or a tendonitis. Sometimes it could be from your back, but more than likely when you lay on it and it kind of hurts to the touch, it's a bursitis or tendonitis. I have trouble putting on my shoes and socks. That tells me that they have lost some mobility in their hip joint, which could be a hip joint. It could be a muscular thing. It could be some weakness. Could be all three of those things. It hurts when I bend down or squat. I can't run, play pickleball, tennis, bowling, etc. This, of course, could be muscular. This could be joint. So we're going to kind of think along those lines. If someone had, let's say, had been playing pickleball and then all of a sudden now their hip hurts, particularly the front or the side, I would probably venture to guess it's muscular. However, somebody who has been losing or their hip has been slowly degenerating and then they all of a sudden develop hip pain while playing pickleball or whatever, it could be a muscular thing or soft tissue because they've lost mobility in the hip joint. So now they're compensating and overusing their muscles. And I do see this quite a bit, particularly people in my age group in their 60s. People just feel stiff. I don't move as well as I used to. And then, of course, rolling over in bed could be a problem that we're going to look for. This is an ebook that I have on my website called Mindful Tips for Daily Movement. These are tips for what you can do during the day as you move about your day. What I find quite often, in fact, like I have somebody right now, she has chronic low back pain. She's had low back pain for 4 years. They've done every test imaginable. We don't know what it is, but she can exercise without a problem. She pushes her husband's wheelchair. She has to help her husband get out of bed, and she's not much older than me, 62, 3, whatever. At any rate, what we realized is things during the day, the way she sits on the couch, the way she gets up out of the chair, were actually her biggest issues, are standing. So that's what this book is. We'll tell you how to do those things. And if you put your email in the chat box with your name, first and last name, I will send this ebook to you as well. All right, so let's talk about the hip. This is what we call the anterior hip. We use those words in the medical field, but it's the front of your hip. So this is if you're looking at someone and you're facing them, okay? And then we took away all their organs and we took away all the big muscles in the front, and what we are left with are what are we seeing here, okay? This big long muscle kind of looks like a pork loin, and I've never confirmed this, but I bet it's the same thing on a pig. Anyway, this is known as your psoas muscle. It's your hip flexor, and it raises your hip up and down like you're lifting your leg to climb stairs. This is the muscle that oftentimes you can see it connects to your spine, and it goes all the way through your body, crosses your joint, and it connects on your long bone, your thigh bone, known as your femur. Thus, it lifts it up and down. It also, so raise the hip flexor up and down, okay? So this, if this is a problem, you might have trouble in the front. Someone comes in and it hurts in the front of my hip. This, after sitting, I stand up, I have pain in my first step. This might be something that I'm thinking is the problem. The psoas will connect with a muscle here that sits on the inner part of your pelvis called your iliacus muscle. And they connect together and they come and they connect down together here on this bone. These muscles are your hip adductors. They sit on the inner thigh, or known as your groin muscle. Okay. Here are your vertebrae back here. This is your pelvis. This part of the pelvis is called the ilium. This part of the pelvis down here is called your ischium, and this is called the pubic bone. Okay. This is your hip joint. It looks like a ball and socket, as you can see in this picture. And in front of the femur bone here, the ball is cartilage. And on the inside of the known as the acetabulum, the socket is called acetabulum, also has cartilage. Around there is something called your labrum, and that can get torn. Okay. Degeneration happens when that cartilage starts wearing away, and that hip joint, which has nice space in it, becomes too close together. And so when you go to try to move your hip joint, you don't have much play in it anymore. So when I examine somebody laying on the table and I take their leg and I flex it up to their chest, I turn it like this. I'm not sure if you can tell what I'm doing there. It's hard for me to show. But if they're lost some rotation in their joint, or I can't, when they lay on their side and I can't extend their leg behind them, I'm thinking hip joint, particularly if it's pretty limited. Sometimes it's just a tight, soft tissue muscle, the hip psoas here. And that's a lot of people who sit for a living and they sit all day long. This is called the posterior hip, or the back of your hip. We can see a lot more muscles here. This is the sacrum. Here you can see that that's here. This is the sacrum. Here's your tailbone, the coccyx, and then here's your lumbar vertebra. So here's that sacrum, and then you have the ilium, part of your pelvis. Here's the ischium, part of the pelvis. Here's your femur bone. We have a lot of muscles around the hip joint. Some of them are very large and some of them are very small. Some of the large muscles we have cut off here. This is the big glute muscle in your butt, called your glute max, gluteus maximus. Underneath you have, oh, you know what? I think this might be labeled incorrectly. Oh no, I see what we got here. Okay, this is the glute medius. We've ripped off the big glute max muscle, which covers the whole area. Then you have your glute medius muscle that comes down here, and the glute minimus. This glute medius is very, very important. As you can see, it connects down here on the femur. When you stand on one leg, this is the muscle that works. And this we find a lot of weakness in. Underneath all that are smaller muscles, your hip rotators or your pelvic floor. One of them is the piriformis. Lots of people love to talk about that they have piriformis pain. It's in their butt. Over my 35 years, the piriformis might be involved, but I don't find that ever to be the primary problem, although a lot of people think it is. What I find to be the primary problem are these deeper muscle under here, which probably you have never ever heard of. The gemelli brothers, gemellus superior and inferior, and the quadratus internus, internus, and the quadratus femoris. And there's actually an apparatus externus as well, but I don't think we have it drawn here. So these are your pelvic floor muscles, and what they do is they rotate your leg. So to pull your leg up, to put your shoes and socks on, you turn your leg in, like to sit, like if you're going to sit, sitting on the floor and your legs are to the side, that would be turning your legs in. But their primary role is they stabilize your pelvis as you walk through the world. 9 times out of 10, these muscles have decided not to work anymore. And because they're small, they fatigue easily. My athletes have weakness here, men, women, younger people, older people, it doesn't matter. This is why a lot of women might have incontinence. These muscles get stretched out, they get weak, they've turned off, they stabilize your pelvic floor, they hold in your internal organs. These are really super important. What happens somehow, these muscles have gotten weak, you've compensated using all these other muscles, and then you overuse them, you strain the glute medius, you strain the piriformis, you strain your hip flexor, because these guys aren't working. So primary thing that we find in therapy is we got to make sure to teach you how to use these muscles again. And this is where that OOF comes into play. They subconsciously kick these muscles into gear. They're also known as your deep core, part of your deep core muscles. All right. So here are your core. Your core muscles are all your abdominal muscles, all your back muscles that go from the diaphragm down to the pelvic floor. These pelvic floor muscles make up your deep core, and this is what's not working on people. So the beauty of that OOV is it will force these muscles to work subconsciously, so you don't have to think about it. As you start training how to use moving your arms and legs while everything stays stable in your deep core. The other piece that's important in your core is this deep one called your transverse abdominis. And this is a large banded muscle, kind of like an armor. It goes all the way around your abdomen and around your back. And those are the pieces that we need to get most often than not in order to heal hip pain, back pain, shoulder pain, anything. We need to work on these muscles here, that core. Very, very important. Okay, here's one more picture of some anatomy here before we get into some other more specific pieces about diagnosis. So this is the back view of your spine. This is your lumbar spine. This is your pelvis. This is your sacrum. The spinal cord goes down through the vertebrae, and off of the vertebrae are nerves that come off. And this is your sciatic nerve coming off of the lower couple vertebrae and out from the sacrum. And they come together to create the largest nerve in your body, the sciatic nerve. It goes down the back of your leg in between muscles here. So sometimes people have like nerve pain, like numbness or tingling. And it may be coming from your back because of something being impinged up here, or it might be impinged here by a muscle. And oftentimes when this is the case, it's because this joint, known as your sacroiliac joint or SI joint, this is not in good balance. And so you might get like this little shifting in here, and it kind of will pull this muscle taut, compressing the nerve, you get nerve symptoms. So we need to look at all those pieces when you come in with your hip pain complaint. You know, is it coming from your back? Is it coming from the hip joint? Is it a muscle? Are you having nerve symptoms? So there's a lot going on here to figure out what is the real problem. Because we want to know what the real problem is so we know how to best treat you. Okay, so if someone has degenerative hip or arthritis in their hip pain, what do they present with? They will tell me their groin hurts when they walk or stand. That's really the most primary complaint. They will have loss of hip joint mobility. So when I assess that hip joint, they have significant loss of extension, bringing the leg behind them or rotating their hip. They will have weakness in their hip because the muscles just can't activate like the way they need to. We will see a noticeable limp. The way they walk will be affected by degeneration in their hip joint. They might have low back pain. They've gone to the doctors for back pain or, and the doctors haven't looked at their hip joint close enough, and it's often in their hip. I had a woman many years ago, and she saw a chiropractor for many years, and I think she had SI joint pain, and he would take care of the SI pain, and he would take care of it, and eventually whatever he was doing wasn't helping. So her friend recommended her to come to see me. I saw her and I said, this is your hip joint. She had that kind of gait pattern where she was walking, where she had this real major hip drop. Let me see. Here you can see how this hip is lower than here when she was walking. So I said, this is your hip joint. And she kind of was in denial for a while until she finally got an x-ray after a month or so. And yes, it was her hip joint. And she wound up with a total hip. I had someone else, a young woman my age, maybe she was in her late 50s. And she walked in here, and I could tell by the way she was walking, because she was walking, her hip trunk was going side to side, and she just couldn't get those hips moving the way we wanted them to. And she sat down and she's like, I think I have this impingement. I've been following this guy online and blah, blah, blah. And I just listened and I assessed her. I said, no, you have a problem in both your hip joints and you need to get to the surgeon now. And she's like, oh, I can't. I've got 3 kids. I'm a single mom. What am I going to do? I said, you know, total hip surgery, for those of you who have that, is the easiest surgery you can get. People are doing great within days. And then of course, you need to get stronger and whatnot, but your pain is resolved. Obviously you have surgical pain, but people do really well with total hip replacement. At any rate, after, we worked on the OOV with her because we could do that. I could help her get stronger, maybe help her with some pain management. But after 4 weeks and she still hadn't made an appointment, I'm like, I can't see you anymore until you see a surgeon. Long story short, she got both of her hips done and she needed them. Weakness. People come to me with hip pain, particularly on the side of their hip, and it's just because they're weak. Those hip muscles are weak. They may be the person who likes to stand. Have you ever seen a teenager stand where they're sort of just standing on one hip and they're kind of turned off all their muscles? They may do that into adulthood, and sometimes people, adults, not just teenagers, but that's the most obvious one. But I have a friend, he is a man, and he was having IT band pain, and he liked to stand on one hip. He just wasn't standing there. I'm like, you need to stand on both legs evenly because you just keep aggravating it. This is one of those tips in my Mindful Tips book that you will get, because what you are doing the majority of your time is really contributing to your symptoms. I find a lot of people come in and they can do their exercises okay, and they don't have pain. They're activating the right muscles, but then they go to sit down and they look like Gumby, or they're walking and they look like Gumby. They stand on one hip. So they need to work on being mindful all day long. So when people come in to me and they have hip pain and we decide it's really just weakness, they may have had an MRI and there's nothing there. The hip x-ray is fine. Weakness doesn't show up on a picture, doesn't show up on an MRI, doesn't show up on x-ray, but we will find it with a hands-on exam. Number one problem typically is those deep core muscles are weak. And as a result, the bigger muscles around those pelvic floor muscles have had to work too hard, and now they've gotten strained, and those are weak because they're so irritated. They will have a glute medius weakness, so they have typically standing on one leg. A very important piece that we have to look at is the foot. People who tend to pronate, where their foot falls in, whether it's falling in from their ankle or falling in from their mid-foot, they then cannot activate their core. So you get the hip weakness and you have foot weakness. So those people, did the foot happen first or did the hip happen first? One problem that we see, particularly with women, is we have our hips are wider than our knees, and we have this large angle here. And so it contributes to a weak lateral hip muscles over here. And then people fall apart down here in their knee, their foot collapses, or their foot has collapsed in order to try to stay straight. So you've got a couple of things going on. It's very important to look at feet when someone has a hip problem. And that foot and hip working together is called neuromuscular control. This is what we're going to work on the most, is to get the feet and your hips working together. Again, going back to that OOV, that has taken care of so much, getting people working that together. I don't know what I did before that. So love the OOV. And we showed you here, she has a little bit of a hip drop. I kind of showed you, this is how women are more susceptible to hip weakness. Okay. Then the third most common problem we see are tendonitis or bursitis. And we sort of covered it, once you have a tendonitis or bursitis, you're going to have weakness. We have to look at the foot, we got to look at the hip, we got to look at your back. So where can you get tendonitis? Well, there's a lot of muscles that go across in front of the hip, the side of the hip, and the back. If we look back, a lot of hip muscles attach all in the same spot right here. They attach here on the side here on this bump. So when people lay on that side and it hurts, it's because the bursa right there is irritated. So bursa is a fluid-filled sac that protects any bony landmark. And that over time, as we age, you lose fluid in there, becomes a little bit more less cushiony, and so that becomes irritated. Okay, so if you have a tendonitis on the side of your hip, that's the glute medius. The bursitis is called greater trochanteric bursitis. You could, let me see here, above, no, I don't have a really good picture of it. Yeah, I don't have a good picture, but above your pelvis here is a muscle called your TFL, the tensor fasciae lata. That is often a problem that gets strained, and then you get pulling down into the IT band, which goes on the outer side of your leg. You could, if in the front, you have your hip flexor muscle, we talked about the quadriceps, that tendon crosses in front of the hip. So sometimes it's a quad problem. The other one that's also in the front of the hip, the iliacus, right here. Okay, so that tendon, it crosses right here in front. The psoas crosses in front, and what's missing here is the rectus, which is your quad crossing in front of your hip. So any of those things could have a tendonitis. All right, and in the back, we have to look if you have SI joint dysfunction. Okay, so how do we know if we can help your hip pain? Is it reproducible? It hurts only when I walk or stand. It hurts only when I sit. Otherwise, it's fine. If I lay on it, hurts, but otherwise it's okay. That's reproducible. If when I kind of poke around on you and I find, oh, that's tender, we usually can take care of it. It is reducible. A number of years ago, I had pain in my low back. On a Monday, I went for a run, it was fine. Pain started going around to the front, into my pelvis, and I couldn't find a comfortable position. 3 days later, it was getting worse and worse. And because I couldn't find any position that would take it away, I knew something else was going on. It wasn't musculoskeletal. So I went to the emergency room. Because it was my low back, they assumed it was my kidney. So they did CAT scan, blah, blah, blah. Nothing, sent me home. 7 days later, it was resolving, but it still hurt. I scratched my back and I had a rash. So I had shingles for a week before the rash showed up. So that is not reproducible pain. It's not reducible with physical therapy. So that's how we want to know, is it something else going on? Most of the time with hip pain, it is something musculoskeletal, unless it's really severe degeneration. And a lot of times I'm the stop where people, they haven't gone to the surgeon yet. They've come to me and I'm like, you need to get to the surgeon, like that young woman in her 50s or that other woman who had been going to the chiropractor for years, or for whatever reason didn't do an x-ray of her hip. I've sent them on and they've ultimately needed a total hip. And when you need a total hip, we're not going to change it with physical therapy. What we can do until you have surgery, if you can tolerate it, do some exercises to get you stronger, get you as mobile as possible so you're prepared for surgery as best you can. But when it's really bad and you need a total hip, you can't milk it. You need to go in for that surgery. And there isn't even a shot for it as far as I know. It's very important to figure out what's causing the problem because your diagnosis will dictate the exercise program. There's, of course, a lot of overlap. But let's say you have a degenerative hip and it's arthritic and there's not much mobility. I'm not going to be stretching that hip joint to try to get more movement. I'm just going to be irritating that joint. So we want to know if it's degenerated or is it soft tissue. And what's the number one mistake that people make with hip pain? They ignore it. So people will wait a long time before they come in. They think it'll just go away. However, the reason you got that hip pain will not just go away. So it's really important, and it's really, we are much more successful in getting rid of your pain if you come in sooner than later. And you can't figure it out on your own. When I have a problem, when I was running regularly and I'd have a running injury, I would go see a physical therapist to see, what is going on, where's the flaw, where's my movement pattern, that's the problem that caused this pain. Very important to come in sooner than later. If you are not on Medicare, you can see a physical therapist without going to your doctor. So if you have, if you're a pickleball fanatic and all of a sudden you got hip pain, come on in sooner than later. Let's figure out what's going on. If I feel you need to see a surgeon, I will send you on. If you have Medicare, you could still see me before you see your doctor if you have a good rapport with your primary and you email your primary doctor and let them know, I hurt myself playing tennis again. I'm going to go to my PT, and he'll say, okay. And then I'll send them a note and they'll sign off on it. If you do not have good rapport with your doctor, or you haven't seen someone in a while, you're going to have to go in and see your doctor first if you have Medicare. Here's a woman who, she said, I'm very excited. She came to me for physical therapy with hip pain, and she feels like she's getting stronger when she's walking and more flexible. And she said here yesterday, for the first time in several years, I was able to travel by train downtown and visit the Art Institute. There were a lot of walking and sitting activities, which previously caused me to be in pain for several days afterwards. But today I'm just a little sore. I feel I've made very good progress in feeling better, stronger, and feel less pain. It's one of our success stories. Here, I think this was actually, this was actually a close friend of mine. Those of you during COVID, what did a lot of people do? They started walking a lot. So here's a friend of mine. She started walking an hour in the morning and an hour at night. And one of those hours she walked with her sister, who was like almost a foot taller than her, maybe a half a foot taller than her. So she was probably taking longer steps than she should, maybe trying to walk faster to keep up with her sister, who had much longer legs and a larger stride length. Wound up with some pretty significant hip pain. And it was, a lot of it was her deep core, those deep hip rotators that we talked about, that she needed to learn how to activate again, as well as she needed to take shorter steps and not try to keep up with her sister. Either A, tell her sister to slow down, or B, every step her sister took, she'd have to take two, something like that. So that was how we progressed that as well. So what do we do in physical therapy to help you get better and get you better back to doing what you want to do? One of the things we do are some hands-on manual therapy. We're going to look at all the joints in your body that might be affected. Usually if you're coming in for your hip, particularly your back, hip, knees, ankles, feet, okay? Your shoulders may be at play here, but probably not as much. However, we will work those in as well to make sure you have good neuromuscular control throughout your whole body. So that's the neuromuscular re-education, particularly getting your feet and core working together. The hands-on manual therapy, we're going to work on mobilizing your joints. We're not cracking joints, but we're mobilizing them to make sure you have enough play in your joint. So for example, here at my fingers, if I lift it up like this, it bends backward. I can't do that actively, but it gives it a little bit of play in the joint. So we want to make sure you have enough play throughout that joint by using some mobilization techniques. We'll also use some soft tissue techniques to reduce any of the restrictions in the tendons or muscles. This is where we combine some traditional hands-on techniques with the non-traditional hands-on techniques. Kind of depends on your tolerance level. Some people can't tolerate very deep, aggressive soft tissue work, so then we'll use more of the gentle approach. And more often than not, there's a combination. And then the bulk of your treatment will be exercise, and exercises promoting neuromuscular re-education. We need to get you stronger, particularly your core, legs, and feet, and we want them all working together. We want to give you mobility exercises, which you might think of as flexibility. We want to make sure you have enough joint play in your hips, spine, and your ankles in order for you to move. And then balance is really very, very important. Everybody, if you have weakness in your hip, your balance isn't going to be so good. Okay. All right. I think that's everything. I hope I remembered. As a thank you for coming today, if you would like a free 20-minute telehealth or phone call to go over what's going on with you and provide some recommendations on what we think will be the best course of action, you can give us a call to set up an appointment. Here are some blog posts that I wrote about hip pain, and these are the links to them. If you put your email in the chat box with your first and last name, I will send you the copy of this PowerPoint, which will give you these links to get you to my website, easier to get to these blog posts. And you will also get this ebook. I have another ebook about balance, another ebook about back pain as well. And here is my contact info. You can email me at denise@themanualtouch.com. You can call us at 847-541-7600. My website, www.themanualtouch.com. Okay, I'm going to stop the share. And let's see what is in the chat box, if people have any questions.
Any questions out there? I think we're okay for the chat box, at least on our end.
Let's see.
See if you have any private messages. Any questions from the group?
No questions in the chat box, just
Yes, could I ask a question?
yes. Where's that coming from?
Hi, my name is Zisel. This was a really
hi, Lisa.
great presentation. I really appreciate it.
Thank you.
I've been kind of puzzling over my hip for years, trying to figure out if I need a hip replacement, what's going on with my back. What do you say about studies that show that x-rays that show degeneration in the hip don't necessarily correlate with pain, and that there are some people that have bone-on-bone arthritis that actually get along pretty well and aren't in terrible pain and don't need a hip replacement? I don't know if you're familiar with any of those.
Well, I'm not familiar with those studies. I think my experience is particularly with the knee. Not everybody needs knee surgery. That's with the meniscus. However, I would say, Zisel, it's really about your function. If you can't do what you love to do, even if you're not in pain, I have a woman right now with rheumatoid arthritis. It's obvious her knee is bone on bone and her shoulder is bone on bone, but she doesn't have a lot of pain, and we're working on getting her stronger and moving.
Right.
My experience is when someone's bone on bone in there. No, I did have a woman, she's coming in today, she just had her total hip. She came in to see me, has a high pain tolerance, 68, I think, was a bodybuilder when she was younger, very active woman, not a lot of pain, but boy, her hips didn't move at all. And she, always felt tight. And I'm like, you need hip surgery. And it was pretty obvious that there was nothing we could do to get her more mobile.
Right.
So Zisel, she wasn't in a lot of pain, but she couldn't do what she loved to do. So
Right.
that's why you would do the surgery.
So what do you mean she couldn't do what she loved to do? I mean,
She couldn't walk as long as she wanted to. She probably
but she wasn't in pain?
not in a lot of pain. No, she didn't have a lot of pain.
So interesting. Okay, thank you. That's interesting.
Yeah. So I think back pain, back imagery, I've heard a lot more about where that does not correlate with pain very well at all.
Okay.
I have not heard about it for the hip. The knee pain, if it's a meniscus thing, they're finding, you know, surgery sometimes is helpful, is 50-50. But a total hip, in my experience, if you're bone on bone and you've lost a lot of mobility in that hip joint, you're just setting yourself up for more problems. And there isn't anything we can do. People have knee bone on bone in their knee. Sometimes they don't have much pain and they can do, you know, they can live with it for many, many years.
Right.
Until they find, you know what, I want to do more.
Do you think that the robotic hip surgeries are better?
I don't have experience with that to answer, to tell you. My patients, they're doing robotic for total hip. I haven't seen anybody with that. I think somebody with a total knee with robotics. So I don't have enough experience to answer that.
Other hip surgeons you like and recommend?
If you email me, I can email you some surgeons.
Okay, great. Thank you so much. Thank you. This is very
Sure.
helpful.
You're welcome. Any other? Beth wants to know, is it bad for your hips to sit with your legs crossed? Yes, it can be. So, and we all tend to do it. But if you're having hip pain, or particularly if you're having pain in the back of your hip, well, no, if you're having hip pain anywhere, you can't sit with your legs crossed. And even if you've been doing it for years and years, usually that could be a part of the problem. So it's always better to sit, you know, with your feet flat on the floor, knees straight ahead. Okay. Any other questions?
You're muted, Henry. Hold on. Hit the mute button, Henry. Henry, we can't hear you. The mute button. It's weird. Or you can write it in the chat.
So someone else asked about hip surgeons. You know, there's a lot, you know, it depends, you know, if you're local and where you live and all that kind of stuff. So I think I'd feel more comfortable if I email you directly.
Oh, there he is.
Oh,
There.
Henry, there we go.
I found the right button. I have osteoarthritis and I have pain in my hips. I have pain in my knees. Do you take your own x-rays or do you rely on a surgeon, an orthopedic surgeon, to provide that information, or how does that work?
Yeah, you have to go to the doctor to get x-rays. I do not do x-rays. I can't read x-rays.
Okay.
So yeah, you'll have to, it's good if you know it's pretty significant, it's best to go to a surgeon that specializes in total joints to take the x-ray. I think they take an x-ray a way that they like to see it. It may be different than if you went to the emergency room or if primary sent you in. They still like to take their own x-rays.
What is your degree of success with osteoarthritis patients?
Well, it depends on the joint. Depends on the joint. Like I said, if it's pretty bone on bone in the hip and you're in a lot of pain and you get loss of mobility, you need the surgery. You know, this one woman, probably the two women I had, they've probably been walking around like that for a few years. I had somebody else who was so bad and she's like, no, it just got bad in the last few months. So sometimes you don't know you've been losing it for a while. My aunt needed a total knee and she waited almost 10 years and she just did pool aerobics and she got stronger and she walked better. However, I don't recommend doing that because her knee changed. You know, it didn't look like a knee anymore. And even after having the surgery, it's not that pretty. So if you wait too long, the joints get, I hate using the word deformed, but it does change. So it kind of depends on which joint it is. A shoulder, really bad shoulder degeneration, you can't push doing anything, you just do the best you can to live with it and keep yourself mobile. So hopefully
you.
that answered your question. It sort of depends on which joint it is.
Okay, thank you.
You're welcome. And the back, people with osteoarthritis in their back, obviously, we can have a lot of success with. There's a lot of different treatments we can do. There's a lot of physical therapy. There's shots. The last thing you really want to do is back surgery. There are cases where you really need to do that. But we do see in the literature that you don't need back surgery as much unless you're really having some significant neurological symptoms. So that's a case where the arthritis in your back, most people live with. And it could look terrible on a picture and an X-ray and an MRI, but they may be pretty functional. And some people may not see much and they're in chronic pain, which is a whole nother animal when you get into chronic pain. I think I should do a talk on chronic pain. I'm gonna have to put that together because there's a lot to go in with that. That's different. Anything else?
Right, any last questions? If you do have any questions, feel free to email here at the Y if you don't have Denise's email, but I did put it in the chat box for those on the call today. And we can put you in touch. With that, again, thank you for joining us today. Special thank you to Denise Schwartz for a great talk about hip pain. Thank you. You can find out today's talk at nsymca.org/YES, where there's all of our information, including past videos, but this video will be up there as well today. YMCA education series free, open to the public. We have about 4 of these a month. Come find out more on our website, again, at nsymca.org/YES. Our next talk is next week, next Tuesday at 7 p.m. on foot and ankle pain. So if you have foot or ankle pain, IBJI will be talking to us about that at 7 p.m. With that, lovely to see you, Denise. Denise will be back in August for a talk on, I just had it up and then of course I took it down, on healing your shoulder pain naturally on August 17th. So we look forward to having Denise again after a nice little summer break. With that, have a great day, everyone.
Thank you for having me. It was fun. Bye-bye.
Thank you.
Denise. Bye.